Hey, in this video, let's talk about hip pain after squats. Hey, welcome back. This is Alvin Wei, your exercise physiologist, here to help you better understand your body so that you can improve in your health, fitness, and performance. So, people do get hip pain after squats, not even squats, in some other movement as well. So in this video, let's talk about the mechanics of your body when you're doing a squat and what are the possibilities of you getting into trouble when you're doing squats. So earlier on, I have put up a video to help you understand the anatomy around your hip. If you haven't watched that, please go do so, go watch them so you understand what are the structures that's around your hip and what can cause you the pain. Not trying to get you to diagnose, but at least you better understand what's going on and what is the possibilities that can get you into a hip pain or a hip problem, right? So in terms of squat, I'll probably have to draw it out and explain while I go through, so you have a better understanding what you should look for when you squat. And when you do this, this is where you understand, but later on the practical part comes when you got to video yourself doing it, and that's, in my opinion, the best way to find out what's basically happening. Alright, so let's not waste time, let's look at my drawing. Right, so whenever we look at somebody performing a squat, it's best to look at them in two different views, one from the front and one from the side. From the front, we're actually trying to see whether this person can actually perform a squat in the most natural way without compensating or overdoing in a certain manner. For example, some people, you will tend to see that when they are trying to squat, the legs are actually not, or the knees are actually not pointing forward. So it's not actually in front. You can actually see some of them squatting such that the leg is going inwards. Okay? There are also some people who tend to do it. You have guessed it. Outside. So the way that they do is basically changing how most of us would squat. So mechanically, there is already something wrong. It could be lifestyle issue. It could be something that has been ongoing for the longest time, and it wasn't caught simply because they don't know what they're supposed to do, right? So they just do as per what they feel most convenient without causing any discomfort or any pain. While this is sometimes short term, and in the longer term, we know that problem is going to come because mechanically we're not supposed to move in that manner. It's just that in that situation, this just happens to that person, right? So from the front, this is what we usually want to look at. From the side, this can be a bit more complex because we get different joints involved over here. So when people get into a squat and you see from the side, a few things that needs to be looked at. So you want to look at firstly the hip joint, and then the knee joint, mainly these two, which will then include the back, the hip, the knee, and then lastly the ankle, right? But this almost not, okay, let me take back my word. For some people, when they squat, they cannot go fully and all the way, and you can see that they actually tiptoe. That is also a problem. Alright, so these are the joints that we usually look at, and it can actually cause problem, right? So when somebody goes into a squat, it would look more like in a zigzag manner, meaning right? So this would be your leg, this would be the hip, right? And this is the head. So this is parallel, and for most mobility work, or when you're just trying to see how far you can go, you are actually supposed to go all the way down, which means that your heel and your buttock is almost like touching each other. That's like full range of motion, right? Rather, it is actually touching each other. It goes all the way, right? You basically can touch each other, and it will look more like this. Please excuse my awful drawing. So this is what I meant. The pelvic or your buttock is supposed to go low, and it is like touching your heels, right? So that's the full range of motion when we talk about a full squat. This is what some people term as half squat. So basically your thigh, your femur bone is basically parallel to the floor. Alright, we can actually go lower. So over here, these are the few things that we look at, and a lot of times you see people doing a squat, and it can be quite alarming, such that the back is supposed to be straight, but for some cases they tend to do it more like this manner. Okay, so to them, they think that they are doing a squat with the back straightened, but this is not the case. Okay, until you video yourself down, you really don't know what's happening, and this can give you a hip problem. There is another scenario where people go into a hunched position. You'll be surprised, but there are people who do this. Okay, so this can already give away how this person squat and what can possibly cause them problem, right? So when we look at it, we will know, oh, okay, this person is actually doing a squat in this manner, how it's going to affect him, and let's check the muscle, right? So mechanically, this is what's happening. There's also one more thing. When you perform a squat, you're supposed to go down this way, but for some reason, some people just can't, and they need to compensate by leaning forward. Some people leaning backwards. So the leaning comes into picture, and it again tells us which muscle they may be using more, and which can also cause them problem. So these are just very fundamentals of how you should squat. I suggest even doing a squat without any weight and video yourself, so that you know where you're at, and it's easier to kind of find out what goes on. Of course, it's really a lot tougher for you, because you wouldn't know what to look out for. You may probably feel which part of the body is pain, and that's about it. For you to correct, sometimes it's not about just doing the right technique. Sometimes certain muscles are already not functioning well, and you need to see someone to go and get it fixed. Depending on how long it has been, it can take some time. Some people, when they're quick, they're diligent, they can do the exercises more frequently than usual. Within 2-3 weeks, they're back. Some people, it may take them even like 2 months, 3 months, because they first need to unlearn and to relearn the technique. They're not supposed to lean forward, they're not supposed to lean backwards. And yeah, a common myth, although I drew this in this manner, the knees and the toes, the very common myth over here is that a lot of people think that the knees cannot go beyond the toes. This is not true. This will not work for everyone. Okay, the knees can go beyond. And when I say beyond, meaning when you look down, you can actually go forward a little bit. Because when you try to keep this back, most people will get into this position, or previously when I say this position. because you're trying to shift it back, right? So ignore about the knees cannot go in front of the toes and whatsoever that people has put out. It's not true. You need to first find out whether everything here is working well, right? So there's the many possibilities. These are just really like the basics of things that we as a professional check to make sure that you are doing things properly before you even want to load yourself up with weights. Alright, so that's basically like the fundamentals of how people should be squatting and things to look out for. Well, it's really more for information. It's not here to help you diagnose yourself why it's giving you hip pain after squatting. So one thing that you can do to see yourself and to see how you're doing it is whether you can actually do it not in the manners that I just described. And the best way to do this is to film yourself doing that. Alright, myself, I do that as well, especially when you're doing with weights and it goes heavier. And this is the time where you really want to check and to correct yourself if you know what to do. Right, and if you don't, my suggestion is to go and find somebody so that they can actually help you correct. Whether it's a muscle issue, whether it's a technique issue, whether it's a form issue, it can be fixed. And there's no point doing movements like that and causing you pain because, first of all, you're not able to fix it yourself. If you could, if you have, you would have. Right? So that's pretty much it. If you like what I put up here, don't forget to subscribe, don't forget to hit the bell, and don't forget to click the like button. It will help me a lot. I will see you in my next video. Please take care. Bye bye.